Good morning. I'd like to update you today on the latest board meeting, which was last week up in Kaitaia. We once a year go to each of the district hospitals and have a look around the district hospital and some of the activities that are going on in the district hospital, as well as conduct the board meeting. We had a hospital advisory committee meeting first of all, and then quite a few hours of two board meetings. So I thought I'd just update you like I did after last board meeting, and I intend to do this each time. So some of the areas that we covered, always at the board meetings we start with quality and safety, and so there were a couple of patient stories, a good and a bad story, and we are very comfortable about airing our bad stories as well as our good stories within the public board meeting. It's an important learning exercise, and the board gets a real clear idea of what's going on. And in fact, even though it's great to have the good stories, we probably learn more from the stories where things haven't gone so well, and with each of these we also outline to the board what we've done to resolve those problems. We then have a look at the patient survey results, and each month we are surveying a large number of patients through an iPad survey, as well as using the national survey, which is an online survey, and there are some other tools as well. So we get a reasonable idea of how things are going from a patient perspective. We reviewed some of the Health Quality and Safety Commission markers, and these are patient safety markers, one in particular around our falls. Both our falls assessment and number of falls was concerning this month, and so Cheryl Beveridge, our Associate Clinical Nurse Manager, came up from Whangarei and gave a presentation, warts of all, as to what we need to do. So our falls assessment rates are very low. That's around our documentation, and so we need to significantly improve that, because what we're also seeing is some falls with harm, and obviously we've got extremely hard floors. They're old and concrete, and that means when our patients fall they do have a greater risk of injury, and we've had a number of fractured neck of femurs late last year around falls, and really it's pretty hard to completely avoid falls, but we must reduce that, and certainly we've got very little excuse if we're not doing the assessments. We talked about how busy everyone is, but we're really clear that even if you're busy, you mustn't compromise documentation, and particularly when it's related to patient safety. That protects the patients, because we then have a plan for the patient, but it also protects each of you. We also talked quite a lot about the health and safety of our staff and the busyness that is occurring, and of course that busyness is related to our growth in population and the demographics of our population. That is, we've got the second oldest, the second or first highest Maori population, rurality, poverty, all drive increased demand, but mostly probably over the last year or two has been a shift of people from Auckland as well. And in fact this year and last year we've had the second highest growth out of any DHB in the country. So that is not only population growth, it relates to acute demand growth, which we're seeing through our ED into our surgery and theatres, and also in our medical wards. We've made a big commitment to the Care Capacity Demand Management Program. Probably as much work has been done on this in our DHB as any DHB in the country, and certainly we've identified some deficits in staffing numbers across the various wards. The ELT has committed to addressing quite a lot of that initially, and we're waiting on our budget announcement around our funding package to be able to commit to more, but we're certainly going to be spending at least an extra $1 million on just addressing nursing staffing this coming year, so that's a real positive. As well as that, of course, we have a lot of growth and new services that we're going to have to also increase nursing, allied health staffing, etc. And certainly we know that our medical and nursing growth has outstripped allied health and clerical, and so there are also deficits in those areas. They're not so much shown under CCDM, which is the Care Capacity Demand Management, but they are actually significant as well. So we are trying to address some of that as well. But every year we have an increase in staff between 60 and 100. We're up to just under 3,000 staff now. So the growth is very rapid, and so we also have to look at how we can do things differently, because basically you're not all going to fit in our hospitals pretty soon, and so already there's issues around parking and everything else, but we can't just keep increasing without also challenging how we do things and seeing whether we can do things more effectively, change our models of care, etc. And there's a lot of work going on there, but I think each of you are the solution around that and have probably identified small and possibly large changes to your work that could make a significant difference. So we really want to get those ideas and support you in making changes where possible. In the report, each time we talk about some of the strategic issues. One of our major strategic programs is the Neighbourhood Healthcare Home Program, and so we're moving into just completing our second year of that program and moving into the third year now of planning. And we've already got over 50% of Northland's population covered under these neighbourhood healthcare homes, and these are general practices that are working in a different model of care, and the goal is over a period of time they will organise themselves in localities, and we might have 5 or 6 localities, probably 5 within Northland, and those practices will be networked, and we'll also have teams that are, which are multidisciplinary teams working on patients and with patients who have significant healthcare problems, long-term conditions, at risk, high priority families and high need families. So a lot more work to do, but some really, really good progress, and I think we're going to start seeing some fruits of that labour in demand reduction within the hospital itself and ED, etc. Financially, we're tracking towards our planned $8.4 million deficit. Remember, this is our first ever planned deficit, and it relates partly to the shortfall in population-based funding that we've received under our CAP. And so we, at the end of last year, got the board to approve additional funds for some patient safety initiatives and significant clinical risk, and that was an increase of just over $3 million. So we now have a planned deficit of 8.4, and we're looking at achieving that and hoping next year that we get a reduction in capped funding, so possibly no cap at all, and then hopefully we'll have the funding we require to provide the services. Having said that, there's never going to be enough funding. That is the nature of health services, and particularly public health services right around the world, and certainly in New Zealand. But we are hoping for an improvement in our financial position next year. Health targets, we always talk about those and look at those. It's interesting to reflect on where the government sees health targets, and I think there will still be an emphasis on some of the health targets, possibly not as strongly as the previous government, but also probably some changes to the health targets. And some of them are very good targets and actually drive high quality care improvements throughout the organisation, and others are probably less effective in that manner. And so we try to make sure that we're doing well with all of those, but you have to be a little careful that you don't, if you like, hit the target and miss the point. So we're being pretty careful also to make sure we're covering off all the other issues that affect patients, and make sure that we're providing really high quality care, which I believe generally and genuinely we are doing. So some of the health targets show that our ED length of stay, we're sticking at about 92% of patients under 6 hours within ED, and that's a pretty good achievement considering how busy we are and the fact that we don't have an acute assessment ward. Faster cancer treatment and raising healthy kids we do very well with. Immunisation is our one where we really struggle, and so there's a lot more work going on. Soon I'm going to write to all of the general practices, providing them with some further information and asking for a renewed commitment. Some of it is not about general practice, it is about our population as well. We have a population that is strongly anti-immunisation, which is a real shame. The evidence is absolutely clear that this is a safe and incredibly effective public health intervention, and it's for our kids, and nothing could be more important. So still a really good target and something we're really committed to, but it's a real challenge for Northland. And I guess elective surgery, which is a numbers target, probably isn't the ideal target, but if you look at our waiting times, they have increased recently. That's because we've made a real commitment to acute services and tried to focus on that ahead of our elective services to some extent, and we've had to do that because we really cannot leave patients who are acutely unwell waiting day after day. Unfortunately, that has meant that our elective times have blown out, and the big problem for us is theatre capacity. There's very little private capacity nowadays. We can certainly do some work up in Kaitaia, and we're trying to maximise that, and I do want to emphasise the really great work that is being done up in Kaitaia and the Bay and in Dargaville, all really important, how those hospitals can contribute to the overall picture and really do a lot of good work. But in addition to that, we just don't have enough theatres here. So that leads me on to some of the discussion we had around our business cases, which are going to be going to the Capital Investment Committee, which is a mixture of Treasury and Ministry of Health, for a decision in May. And the particular business cases that we have is 2 extra theatres to be built adjacent to the current theatre block, a lot of internal work within theatres to improve conditions and in that area, and also an endoscopy suite built in our old delivery suite. We've got a business case in for a cardiac cath lab, and that would be placed and situated adjacent to the old delivery suite. And really that's about ensuring Northlanders get timely treatment in Northland for some of the cardiac procedures that significantly improve their mortality and morbidity. And so very important initiative that we've been working on for some time. As well as that, we've got a community mental health facility that we're hoping to purchase, and that will allow a lot of our community mental health services to move out of the hospital and Manu House and Kimiora and prefabs and buildings all over town and be consolidated in one facility in town, which is great from an access point of view for patients. And finally, we've also got a business case in to shift our ophthalmology outpatients, which is incredibly crowded and cramped at the moment, and move that into the service wing on the 4th floor. So those 4 business cases total about $35 million, and so we're hoping to hear back from the Capital Investment Committee following the budget. So the budget is 17th of May, and a lot of decisions are contingent on that, including obviously how much funding we're going to get, and so we're eagerly awaiting announcements regarding that. I also discussed a few of our other community programs, and we've got a fantastic program going which is funded by Proceeds of Crime, and we have received $2 million per year to work with the police, who've received another $1 million to develop a methamphetamine demand reduction program called Te Ara Oranga, and that's an exciting program where we're collaborating with police, getting people back into jobs, identifying people early who have issues around methamphetamine. It does feel still like we're a bit putting the finger in the dike, and it's certainly a big tide of demand and issues around methamphetamine that we're fighting against. But I think it's a really positive program and is being evaluated at the moment. Always talk to the board about some of the highlights and lowlights, and focus on some of the highlights first. And we've had some really good results around newborn hearing screening, established our telestroke service, using mobile devices for public health nursing, which is exciting, and we've just recently approved the upgrade of our PACS system, which is our radiology electronic system, and quite significant enhancements will come with that upgrade. Unfortunately, the lowlights really are also probably some of the most troubling, which is around our suicide rate, which last year there were 42 suicides in Northland, and this year we've already had 12. Not so many in the youth suicide area, which is a particular focus because of that's an area where we believe there's significant work that we can do, but these are probably more males, not necessarily Māori, and in middle age, but an absolute tragedy because every one of those, of course, affects so many families. And so there is some work going on in that area, and we're really trying hard to reduce that, but obviously these are not just health issues that contribute to this. Another area that troubles me is our road traffic accident rates, which are again similar, around 40 last year, and again this year very high numbers, and that's related probably to our roads a little bit, but some other factors as well. In both these areas we've got at least twice the national average, and I think road traffic accidents also I guess represents, certainly the deaths represent the tip of the iceberg, and we are seeing an awful lot of trauma coming in through our EDs, and that drives an awful lot of work and extra demand for services, and we don't get funded at the level that we are seeing the work done, and so we only get funded at about 4.5% of the population's total population's funding, and of course we're seeing 8 to 10% of the number of road traffic accidents and deaths. So that's one of our challenges, unfortunately. In the public excluded meeting, I discussed a number of risks, and I just highlight a couple of those. We talked about our maintenance program, and we have a good maintenance program, even though I'm sure all of you will have seen things that need to be done and it might feel slow. We do spend $2.2 million, and we're approving increasing that to $2.5 million next year. There's been some publicity recently about maintenance and lack of maintenance in some DHBs. We try and maintain our very old buildings, some of the oldest in the country, as well as we can, and keep the ministry and minister updated on that program. And obviously for us, the big issue is that we need to develop a new Whangarei hospital, and that's a huge program of work that's underway, and we've discussed already some of the options around that program, and just thought I'd highlight to you 3 options that are being presented to the Capital Investment Committee, that is Treasury and the Ministry, in about July of this year, and it's the second stage of our business case process, and we are talking about one of 3 options and our own preferred option. So there is an option to build in the patient car park outside Manu House, what used to be the tennis court many years ago, and that I will call option 6. The problem with that is it ends up extending straight in front of our ED and does create significant problems around access while building for a number of years. The second option is to build out from in front of the maternity unit, between maternity and ED, a large building many stories high, probably about 8 stories high at one of the higher parts of the DHB. So that's somewhat of a disadvantage because it'll be significantly above the level of, say, Manu Road, but also we need to move out through towards Tūmanakau Tumanako, our mental health unit, and of course that requires us to take out quite a lot of the hill, potentially the swimming pool, potentially the huge Camphor laurel tree, but is called option 7. And then option 8 is to build in the car park and around where Child Health Centre is currently, the car park adjacent to that, and down to West End Ave. Fortunately, we own all the houses and buildings along West End Ave, right to Hora House, and so that provides us with a large footprint to build a new hospital there. That's our preferred option. It's simpler, much more straightforward, less disruptive, and so we are presenting those 3 options in a business case with our preferred option to the Ministry and Treasury in about July/August. Once we've decided on that, there's still further business cases required, but there's been a lot of good work to come to this stage, and that's with an awful lot of clinicians and staff within the organisation. Apart from that, also updated the board on the Bay of Islands Hospital rebuild, which is nearly complete. We're hoping to complete that in late August, and certainly still a fair bit of work to do, but making good progress with that. And that is a ED, accident medical area ED on the ground floor, and ward above that, adjacent to some of the current buildings within the Bay of Islands Hospital. So that's been a program which has been worked on for a number of years and very exciting, and we're hoping to hear more about the next phase of that program, which is to build a primary care centre and outpatients over the next few months. So that would complete the renovations and upgrade of Bay of Islands Hospital, certainly for the foreseeable future. Finally, we approved, and this is really to just give you an idea that we don't just own hospitals. In fact, we've got a budget of nearly $635 million, and at least $250 million of that goes to community contracts and community providers. That can be anything from pharmacy to aged care. So this month we approved $70 million of contracts to aged care services. That's rest homes and private hospital or rest home hospital level care, as well as home-based and home and community care support, and also palliative care. Pharmacy contracts, we have spend well over $40 million, and primary health care, there's over $40 million of contracts there around GP services, etc. So a large, and then we've got community labs and a number of other community mental health providers, etc. So a large number of contracts and a large amount of money is spent on community services that we don't own but do fund. And then on top of that, we spend about $78 million on interdistrict flows, where we have to pay for services and receive services from other districts, such as Auckland, where probably about $70 million of that is provided. And a lot of that is tertiary care, but also patients who are on holiday or moving between families, access care, but identify Northland as their home. So that's a bit of a summary of the last board meeting, and I'll continue to do this. I enjoyed speaking to quite a few of our staff, and particularly our leadership, on Monday about this, so I met with them. But any of you that can't go to those meetings, this is an opportunity for you to just have an understanding of some of the things that are happening broader around the organisation, and me trying to be able to update you. And if you've got any questions, don't hesitate to send me an email, or I'm very happy to try and answer those. So thank you, and we'll see you next month.